Welcome to the fourth video in this module. In this video, we will see how trauma affects the entire nervous system, both sympathetic and parasympathetic. Since the sympathetic nervous system is like an accelerator and the parasympathetic nervous system is like a brake, trauma survivors end up with a variety of responses that are either too much or too little, or both. So let's get started. Let's start off talking about the polyvagal theory. The polyvagal theory explains how trauma impacts both branches of the autonomic nervous system. The first branch is the sympathetic branch. That's the part of the nervous system that regulates physical and emotional acceleration. For example, when we experience increased fear or anger or heart rate, that's coming from the sympathetic branch. In the case of extreme danger or crisis, the sympathetic response will result in the classic fight or flight response. Now, the second branch of the nervous system is the parasympathetic branch. The parasympathetic branch is responsible for emotional and physical deceleration. And there are two sub-branches to the parasympathetic branch. There's the ventral sub-branch, which is responsible for social engagement. For example, our ability to smile, laugh, experience empathy, attunement, provide validation, etc. But then there's the dorsal sub-branch. This is responsible for what we call rest and digest functions. This is the part of the nervous system that helps us relax. In the case of extreme danger or crisis, this is the part of the nervous system that causes freeze. So the freeze response is when the organism either mentally dissociates or just physically faints. When there is danger, the different branches of the autonomic nervous system are affected in a very specific order. First of all, when there's danger or crisis, the first part of the nervous system to be affected is the ventral sub-branch of the parasympathetic nervous system. Remember, that's the part that's responsible for social engagement. In other words, when we are in the presence of danger or crisis, the first thing that happens is our social connectivity goes offline. Our ability to smile, laugh, connect with other people, etc. If the danger or crisis persists, then the second part of the nervous system to be activated is the sympathetic. Remember, the sympathetic nervous system is like the accelerator. Now the organism is ready for fight or flight. If fight or flight does not do the trick, does not get the job done, and the threat persists, now the dorsal sub-branch of the parasympathetic nervous system is activated. Remember, that is the part of the nervous system that's like the brake. So now the organism freezes, either dissociates or faints. We can think of the sympathetic nervous system like an accelerator and the parasympathetic nervous system like a brake. So we're going to use the analogy of these two pedals to explain how we end up with trauma symptoms. Think about it this way. Life is like driving down the highway. When we're driving down the highway, we need both pedals. We need to sometimes accelerate and sometimes brake. If the drive is smooth, sometimes we will gently accelerate and sometimes we will gently brake. That's exactly like our sympathetic and parasympathetic nervous systems. Sometimes they gently accelerate, sometimes they gently brake. Now, what happens if we're driving down the highway and a truck suddenly swerves in front of you? If that happens, you might demonstrate all of the reactions presented in the polyvagal theory. For example, first of all, you might swear and flash various fingers. In other words, your social engagement system just went offline. You also might suddenly accelerate to avoid an accident or suddenly slam on the brakes to avoid an accident. But then once you avoid the accident, you will probably return to your baseline of just gently braking, gently accelerating as necessary. You just continue with your drive. But now what would happen if there are constant roadside dangers? Every which way there's a potential accident happening. What are you going to do? Well, you might decide to never let down your guard. You might constantly yell at other drivers. you might constantly accelerate or constantly brake, maybe even at the same time. In fact, this might become your new default driving style, just yelling at people, braking, randomly accelerating. If that happens, now your driving style itself is inherently dangerous. Even if there's no roadside peril at this point, your driving style itself is dangerous. This driving metaphor describes what happens when we experience repeated trauma. So basically what happens is both the sympathetic and parasympathetic nervous systems are hijacked. The individual is constantly applying both the accelerator and the brake, and many times both at the same time. This leads to many responses which are either too much or too little, because the person constantly is putting on the accelerator or putting on the brake. The sympathetic nervous system is activated, and so is the parasympathetic. And this affects 5 domains in particular that we'll talk a lot about throughout this course: awareness, thoughts, feelings, reactions, and relationships. What happens in each of these 5 areas is the person ends up either having too much of a response or not enough. So for example, too much awareness or not enough awareness, too much thinking or not enough thinking, too many emotions all at once or not enough emotions, overreacting or underreacting, or even overrelating or underrelating. In other words, being too aggressive or too passive. So DBT is designed to teach a middle path between each of those 2 extremes that we see in each of those areas. So let's summarize with a few key points. First key point: trauma affects both branches of the nervous system, sympathetic and parasympathetic. The sympathetic nervous system can be thought of as an accelerator, whereas the parasympathetic nervous system can be thought of as a brake. Key point number 2. When we are faced with a danger or crisis, our sympathetic nervous system is supercharged, resulting in either fight or flight responses. This is analogous to slamming on the accelerator. However, when neither fight nor flight responses are possible, the parasympathetic nervous system becomes supercharged, resulting in freeze. This is analogous to slamming on the brakes. And our final key point: based on their life experiences, people who have experienced chronic trauma have both branches of the nervous system overactivated. They're constantly over-accelerating on one hand and over-braking on the other hand, and often executing both functions at the same time. That is precisely why people with trauma histories constantly have responses that are either too much or too little, resulting in extreme polarities, or what we call dialectical dilemmas. In other words, people are stuck at the extremes.